Well, this morning on today's checklist, we're going to talk about the importance of routine blood work and making sense of those sometimes confusing lab results. And here to help us do that, board-certified surgeon, Dr. Cedrek McFadden. Welcome back, Dr. McFadden.
Good morning. Thank you.
So first of all, how often should the average person of average health, how often should they be getting these routine blood labs, and what numbers should they be looking at?
Yeah, so for most of us, we're going to be doing this blood work every 1 to 2 years.
Okay.
However, depending on your medical history, you may be doing it more frequently. So if you have chronic diseases like heart disease or diabetes, you may be doing this more frequently. Also, the number, obviously, it's important, the cadence that we do this. What's even more important is the change that we see in these numbers, right? If there's a shift in the baseline that you normally are around, that becomes really more telling. And particularly, what we want to remember is that if there is a change from your baseline, we want to see if it's going up, is it going down? Is the abnormal labs that we're seeing, are they related to other symptoms that you could be having at the time those labs are drawn? We don't treat you just based on a single number.
Got it.
We treat them based on how you're doing. Are there other medications that you're taking? You know, at the same time, did you eat before you take this lab? Because again, that can influence the results.
Okay. My friend Emily has a few questions.
Okay, so I feel like we get blood work done, and so often we're looking normal, abnormal. Should we be looking beyond that? What does normal even mean?
Well, I think normal is probably one of the most misunderstood terms in medicine, right? Because normal really doesn't exist. What this term really reflects is it's like a statistical range for a large population for these numbers, right? So the perfect example is if we think about cholesterol, total cholesterol, most of us think under 200 is where you want to be. Well, the change is what's important here. We talked about that just a second ago. We want to see if there's a fluctuation.
Sure.
If we find that you're 150 today, that's great. It's in normal range. But say we check your numbers again, and now you're at 190. It's still normal. However, there has been a change in not a positive direction. So I like to tell people, let's focus less on the normal and more on asking, is there a change?
Sure.
Because that's the really key question to ask. Is there a change, and is that now influencing what we should be doing with this information?
Okay. All right, we'll keep moving on down the aisle.
So, Doc, you get your labs. You're looking at all these numbers. I mean, just a ton of them. What are the ones you really should be looking at?
All right, so this is the alphabet soup here. All right, so it gets a little bit challenging here. But there's a CBC. There's a complete blood count that tells us about your hemoglobin, your white blood cell count, about infection. That's a good one to know. Comprehensive metabolic panel, your CMP. That looks like your electrolytes, looks like your kidney function. It also looks at your liver function. If you're ever in the ER, you're not feeling well, these are one of the main two that they're going to get in that setting. Also, your lipid panel that we're talking about now, starting to check earlier in life and doing something about it if they're abnormal. And the A1C, this is a test that you cannot cheat. This is a test that the night before you can't say, I'm going to eat well. You can't do that with this one because it reflects the last 3 months of your eating habits and how your body's managing sugar. So that test is a really great test to look for diabetes.
Okay, so you get all these tests and you're looking at all these numbers.
Yeah.
Should I have my doctor? I don't want to read it. Just tell me what's going on.
You don't want to dig into your phone.
I don't want to dig it. Just tell me.
So here's the thing. I'm a personal advocate for my patients knowing as much about themselves as possible. So I want you to look at those numbers.
Okay.
But I want you to look but not leap. Okay. What does that mean? I don't want you to leap into the Google world, not having the context.
Yeah.
Because that's what's important. Because we're not treating a number. You can have a number that's slightly off that we don't get very concerned about.
Right.
But if we see that you're having symptoms with those changes, or if there's a pattern, and here's the key, if there's something that's really critical, your doctor's likely going to reach out to you and say, all right, we got to do something different. It's really the action after that.
Because when I get on my portal, I get these numbers. Has my doctor seen them already, or?
Typically they have.
Okay.
Typically they have.
Your doctor has. Your doctor.
That's just because he has so much practice doing it. Oh, it's him again.
Thanks, McFadden. Always a pleasure, man. Thank you. For a checklist of questions to ask your doctor about those labs, you can go to today.com.
Hey, thanks for watching. And don't forget, you can catch the Today Show every morning on NBC or take Today when you're on the go. Just follow the Today podcast on Apple Podcasts, Spotify, or wherever you listen.